The CDC has added conditions like depression and schizophrenia to the list of risk factors for the most serious cases of COVID-19. That list also includes things like cancers, heart conditions, and having a weakened immune system.
That's right. Well, joining us today to talk more about it, Dr. Thea Gallagher, a clinical psychologist and assistant professor in the Department of Psychiatry at NYU Langone Health. Dr. Gallagher, thanks so much for being with us.
Thanks for having me, guys.
So let's jump in. Talk to us a little bit about the link right now that we're seeing between mental health, physical health, and how that ultimately all connects to COVID-19.
I mean, I think it's really shedding a light on the fact that we are so much more integrated, mind and body, than we have previously believed. And I think, many psychologists understand this, and the data reflects this as well. But I think for some reason over the years, we've really separated, it's all in your head. Mental health issues are not connected to your body, but we do know that when you have mental health conditions, it does take a toll on your physical body, on your physical health. Those stress levels can impact your immune system, and your physical body in pretty, powerful ways. And I think this data is really impressive in the sense that it's showing that there is a link there.
Doctor, we've heard so many experts saying that after the health crisis of the pandemic, the next pandemic is going to be a mental health crisis. So what do you think are some of the consequences we're going to suffer as a result of the pandemic when it comes to our mental health?
I think we're actually already in that crisis, and we've been in that crisis since day one. I would say that I think we're even starting to see the aftershocks of the mental health crisis as a result of, things are getting better numbers wise with COVID. But I think we are going to continue to see an uptick in depression, anxiety, suicidal thoughts and behaviors, because our lives have drastically changed. Many of us have been in crisis mode for the last year and a half plus. And so I think now is a really important time for, just to start thinking about individually how we're going to address our mental health and make sure that we're taking care of it and being on top of some of the stressors and the things that are impacting us. But I think globally, we need to start thinking what are the resources that are going to be available to people, readily available, because access to care is becoming an issue because so many people are recognizing I need that mental health support, but then going to get it is becoming more difficult because everyone's doing this all at once.
And I feel like we're really all just kind of in this really heightened state right now. Talk about the age groups in particular. I don't know, are you seeing them across the board, people who are negatively impacted, or is it younger people, adults, or kind of a mix of everyone?
It's definitely a mix of everyone. What we're seeing is maybe some different symptoms in different age groups. We know with millennials and Gen Z that that social isolation at a time in your life when it's so important to be making connections and moving up in your job, and you're kind of looking at goals, that's been really difficult because a lot of them were put on hold, or we had to stop our lives in a lot of those areas. And then with older individuals, we're also seeing the impact of isolation. And then with parents, how stressful the last year and a half has been, touch and go with whether kids can be in school, whether you have to be a full-time teacher and a full-time employee in your other job. I mean, I think it's impacted every group in some similar ways, and then some different ways.
Right. So, Doctor, earlier we were talking about these social emotional surveys being given to kids in classrooms, right? For adults, do you think it should be a practice of the primary care physician kind of giving you a survey asking you, how are you feeling? Can you rate your mood from 1 to 10 just to nip it in the bud if someone is experiencing some level of a mental health crisis and they may not even know it?
Yeah, I think we can't emphasize this enough, how important it is that we are looking at the whole person. And I think this data should hopefully, improve that, seeing there is a connection between our mental health and our physical health. And, we should be taking care of our mental health just as much as we're taking care of our physical health. And I think a great way to start is in, primary care settings, to start taking those assessments to see how people are doing, and then make sure that we can have access to resources after we understand how people are struggling or suffering.
Absolutely. Dr. Gallagher, thank you so much. We could just keep talking about this because there's so much to cover. We would love to have you back at some point, but thanks for being here tonight.
Anytime. Thank you so much.
Thank you.